when I started to prepare this talk, I look back to almost 4 years to the day, when many of us who are in this room would have got together for our first transition meeting. And at that meeting, what we were really trying to do was define the problem and get broad agreement that we needed a lot of work doing, and to try and find a way forward with what we thought this is a very difficult subject. And we talked about the difficulties that young people are facing at this time of handover transition from young pediatric services to young adult services. And we talked about the differences in the services. We talked about the fear of the loss of the long-term relationships that people have with their healthcare providers. Oh, at that time, we were just starting out and just trying to find a way forward. This is a slide stolen from Sarah, but it just shows where the HbA1c is at this particular time when we're looking at transferring people from one service to another. It's a time from about 10 to about the mid-20s, when the HbA1c is always the highest. So this big change in service happens at a time when people's control is at their worst and people are their most vulnerable. We also know that the death rates amongst 10 to 19-year-olds haven't changed much since 1984. They fell quite sharply to 1984, but since then, this is USA data, but since then, not much impact has been made. And at the time, I described this as the perfect storm. So I was very cheery and very, very upbeat at that time. So I apologize for that. But what I would like to say is we've come an awful long way since 4 years ago. Thanks to a lot of the people who are present today. We've still got a long way to go. But I just wanted to look at some of the things, some of the things that we've done to move along, and some of the challenges we've still got lying ahead. The first thing we did was appoint Sarah Crowley, our diabetes transition coordinator, which enabled us to have a proper focus on this area, a full-time focus. And one of the first things that Sarah did was create these standards for moving people from pediatric to adult services in diabetes. And these are actually the envy of a lot of services in England. We're way ahead of a lot of services in England with these. And I think a finalist for this year's Quality and Care Awards, is that right, Sarah? So this was a very important first step in defining what we wanted our services to look like, how we should change them. And we started to get some literature to support this, handouts and leaflets that are written specifically for this age group. And then we'll hear later from the fabulous Rose Stewart, who has started us in developing psychological resources for our young people with type 1 diabetes. We have films, many of which are really aimed at young people, for example, travel, high-level exercise, sick day rules, etc. So these resources have all been developed. We've also now got youth workers appearing in Wales. When Sarah first mentioned this to me, I think it was about 2.5 years ago, I thought, well, this is a pipe dream. You know, I don't know, this sounds fabulous, but I don't know that we'll be able to achieve it. But, you know, 2.5 years later, we now have the first full-time youth worker in Cardiff and Vale following a successful pilot. We've got a part-time youth worker in Ynyr and Bevan, and this is a type of model that we want to spread to the rest of the country. And I think Sarah, Sarah is speaking about youth work later on. We've also got some diabetes eating disorder teams starting to form across the country. And this is really in recognition to the importance of eating disorders and diabetes in young people. We've got other pieces of the jigsaw starting to come together. We've now got a national programme of peer review for type 1 diabetes, which commenced on the 1st of September. It's starting in Cardiff and Vale, and this will include transition services as part of this review. We've also got a type 1 pathway for the first year of diagnosis in creation, which I'm hoping will be completed very shortly. England and Wales have had a national quality improvement programme in transition, and I know we've been participating in Cardiff in this, looking at targets such as reducing non-attendance rates, reducing diabetic ketoacidosis rates. We've put resources into pump services, which has been helpful, but we do need more resources there. Health Technology Wales are planning a review on continuous glucose monitoring, because we know we've got a lot of variability between services, with some services having no barriers and other services finding it very difficult to access. We've now convened the type 1 group looking at sports and diabetes, and we're hoping to move that along fairly quickly now. And we've also got a new structured education for the 16 to 25 year age group, which Sarah is going to launch today. So we're very, very excited about that. And moving on to a little bit of where we've still got a way to go. The transition audit was published in 2017. It's a combination of the National Diabetes Pediatric Audit and the General National Diabetes Audit. So in 2017, we saw most transition happens between 16 and 19, which we anticipated. I don't know how well this projects, but this is the original data. The grey is Wales, the blue is England, and it's looking at differences pre and post transition. And in that data, we saw some things got worse, such as HbA1c, some things, such as blood pressure, got better. And we also saw a drop-off in the attainment of HbA1c targets. In this one, blue is pre-transition and grey is post-transition. And this one over here is Wales. We also had another transition audit published in January of this year. And this gives us probably more defined data, and it also gives us service-specific data. And I thought I'd show this slide because it's Cardiff and Vale. This is my own service, and I've seen Justin Warner present this, because it does show quite a difference in paediatric and adult services. The dark blue here is Cardiff and Vale. The light blue is all Wales and England combined. And what you can see in this is that pre-transition, we have 100% attainment of HbA1c, and post-transition it's falling to about 57%. And you may ask, why is there such a big disparity? Partly this is the way the data is collected. The pediatric data goes in directly. The adult data is collected from extraction in primary care. So if we don't convey the results, and if the results aren't entered, it doesn't get extracted, basically. So I'm hoping that projects such as the Wisdom, such as Phil Evans in the middle is working on, will help us to have proper secondary care data in the near future, so we can get a better picture. But I think one thing that we do know is that certain things do fall off after transition, and we're really working hard now to see if we can find different ways of addressing these and improving them. This is just showing that some things get better. This is from ABMU, now Swansea Bay. You can see that this is blood pressure, and this gets better following transition, as does foot screening. So there are variations, and overall, you can see that things vary. If they're going towards the bottom, it's better before transition. If it's going towards the top, it's better after transition. So we know we've got a way to go. We've recently surveyed teams in Wales about their transitional services, or their services of transitioning young people from paediatrics to adults. And what I can say is that services have been making big changes to try and improve the situation. They've been changing their structure. Most services are very looking forward to the new education initiatives that come out. We know there's a lack of resources. This particularly comes loud and clear from the adult services, that there's a lack of resources around this. And we know that almost every service quotes the lack of access to psychology services post-transition. And this is a very real issue that we hope we can address, and we hope that the peer review will do something to address. But we're moving forward. This is a journey and we're moving forward. And today we're going to take some more steps on this journey. We're going to hear about the new psychology support resources that are available. We're going to get the launch of the new structured education for young people. We're going to hear about the LBGT plus inclusivity today. We're going to talk about youth workers. We're going to examine eating disorders. So we're moving forward with this all the time. So before I hand over, I'm going to just say a big thank you to everyone in this room, because all these developments and advances that I've been talking about for the last few minutes really comes from most of the people in the room, the people who have had interest and passion for this area to make this better. So a big thank you very much to everybody in this room.